today I have a pleasure of hosting four amazing panelists who represent different aspects of this topic. Right? We have Mélida, who represents the language company that is, for whom the productivity, quality are very important, and managing of the interpreters. And we have Nathan, who represents a large healthcare system that obviously utilizes internal staff interpreters and also works with other companies, and those issues are something that he breathes every day. We have Andrea Henry, who is an interpreter and a researcher who is interested in how do we interpreters put up with all that. And we have Anita Coelho Diabate, who is an interpreter who participated in a couple of projects that deal with these issues on a daily basis, and also works for a large system and sees it from within the system. So these are four different views. Each of the panelists will introduce themselves, and Anita will be our host and directing the conversation. Anita, the floor is yours.
Thank you so much, Natalia, and thank you all for joining us today. This is a vibrant and lively subject with some really terrific participants, so thank you, panelists, for being here. My name is Anita Coelho Diabate. I work for the Cambridge Health Alliance. My office is in Malden, which is a suburb of Boston, but our metro areas are about 5 or 6. We have 3 major hospitals and right around 20-something clinics and extended facilities into primary education as well. I am a VRI OPI interpreter. For those of you who don't know those acronyms, that's a video remote interpretation and over the phone interpretation. I started out as a face-to-face interpreter, but shortly thereafter was invited to pioneer new model or mode of operating as an interpreter. While I don't have a lot of access to the dashboards for quality versus fatigue versus productivity, I can tell you that from my own desk, I know that I set the bar pretty high and try and do the best I can to balance work and life and fatigue, and so that I can be as productive and as high quality an operator or practitioner of interpretation services as possible. Mélida?
Thank you, Anita. Good afternoon, everyone. My name is Mélida Fernández, and I am Director of Quality Assurance for LanguageLine Solutions. I've been with LanguageLine for 24 years, started as an interpreter. Very proud to be a LanguageLiner. I've been in the industry for 30 years. I am a federally certified court interpreter. I am an interpreter at heart. I do manage a very large team of interpreters. We currently have over 16,000 interpreters, and I am responsible for the quality monitoring of the interpreter and for the coaching that we provide to our interpreters to ensure they can be successful. So thanks everyone for being here today. Nathan?
My name is Nathan Salzl. I'm a data analyst, first and foremost, for the Health Partners system. Specifically, I work for Regions Hospital. We have several hospitals and a lot of clinics in our system. We have several staffed sites, and we have remote services and a pretty robust agency interpreter system in our community. My community is Minneapolis, St. Paul. Some people call it the Twin Cities metro area. And so my background is really not in interpreting. I hadn't done anything with interpreting before coming to Regions Hospital, but I have a master's degree in program evaluation, and then got into nonprofits, really working with database management and data and reporting and how do you collect program statistics, and that kind of evolved my career. And here I am at Regions Hospital working I do a lot of financial statistics as well as this staffing statistics and productivity work.
Thank you.
Yeah, thanks for letting me be here.
I'm Andrea Henry, and I'm a full-time interpreter and a part-time researcher. I work at Children's Healthcare of Atlanta, and I mostly do face-to-face, some over the phone, no VRI. And I've been in the field for 25 years. I've been at Children's Healthcare of Atlanta for 18 of those years. And there was a period of time where I did full-time over-the-phone interpreting in Portland, Oregon in the beginning of my career. And I also did freelance interpreting in Portland as well. And I spent about 6 years in management at 2 different hospital organizations here in Atlanta when I first got here. And so I look at the fatigue question from the standpoint of, you know, taking that as a measure of productivity. And that's why we created a tool at Children's Healthcare of Atlanta to understand the demands on concentration for interpreters and look at that as fatigue and then incorporate that into an actual productivity percentage. And we are at the, hopefully, in the end zone at this point. And so it's very exciting to be here and to get to share with all of you.
Thank you. So I have a few questions that I'd like to pose, and I want you all to just jump in. I won't, I'll only choose if there's a dead silence. But these are springboard questions. So if you have a different question or a question that's related, please feel free to pose it and answer it. So the first question we have here today is, how do you measure balance and productivity versus quality in your organization? And I will take Mélida as our first, and then we can go from there.
Thank you, Anita. Again, as I said, I am an interpreter at heart, and I think that it is important that you are aware of the standards. We all know that, let's go to basics. Any guidelines that you have within your organization, any performance measures, that you are aware of how it all works. So it's important that you ask clarifying questions. If this is not the information that is being shared with you upon being trained, you should feel free and you should demand that these questions be answered. You want to know exactly what it is that's going to be measured in terms of productivity. How can you make sure that you meet clients' demands, right? Their needs. And at the same time, how can you go about maintaining the overall quality of your rendition? So have clear expectations, ask questions, have a coach. Do you have a coach? It's wonderful to have a coach who is also your mentor, your best friend. And remember that you can be a coach to yourself, because part of the overall coaching experience is self-assessment, but always be open to any coaching from that individual that's going to be walking you through. So again, bottom line, have all the expectations in line, understand what you're in for, and be true to the art of interpretation. It's a very noble profession. It is a profession, it is a career, and we should all be very proud to do what we do. Language access, we secure that, but we're also securing language justice. So, Andrea, yes, ma'am. Any thoughts?
So, yes. Oh, did you say Nathan? Sorry,
No,
go ahead, Nathan. Was that?
No, I think she called on me.
Oh, you, Andrea.
Oh, you did? Oh, okay. I'll be briefer on this because I think Mélida and Nathan in their roles probably have more to offer. I'm a staff interpreter like Anita, so I know that my management looks at productivity and quality. We have a very fleshed out management at Children's. We have a system manager over multiple hospitals and clinics, and then a supervisor who's over the same facilities, and then we have multiple team leads, and then dispatching. We have 2 dispatchers. So as a staff interpreter, I'm aware of what they're looking at from the standpoint of numbers of encounters, and they look for growth. We get lovely graphs at our staff meetings so we can see the growth of encounters. So they're looking at it from that standpoint, and they share that with us, but they're always looking at other ways to understand really what's going on in other measures. So it doesn't seem like it's static. And the tool, since it's still not completely done, it's not part of the way we measure yet, but there's a tremendous amount of support for it, because the idea is it should add another layer. There should be something that it will offer with all these other pieces, so that we have a much more accurate picture of what an interpreter's productivity is when you incorporate the complexity, just like they do with nurses. So nurses or nursing are, their staffing is based on acuity. So if you go to an ICU, for example, they're required to maybe have two patients at the most. Because those patients are so sick. Their acuity or their complexity level is very high. And nursing in a day surgery area or a clinic is definitely, the acuity is lower or the complexity is lower. The needs of the patients are minimal. And so they have much more responsibility, more patients per nurse. And so the idea or our premise for the tool is really to look at interpreting in much the same way, not necessarily department-based, but characteristics-based, and using the tool to actually have a way to assess complexity in the very same way that they assess complexity for nurses, depending on what kind of patients they have.
And just very briefly, having used this tool myself in the pilot, for those of you who don't are having a hard time conceptualizing, it's a simple questionnaire that can be done after any interpretation that you've done. You can select the interpretation that you feel most appropriate. If there was any sort of disturbance, whether or not you can hear some motors in the background, it might have been very tough for me to manage it, mental health interpretation, for example, or perhaps I was tired, or maybe I smelled something delicious, or there could be any number of things, and it actually addresses any and all of those measures very quickly. It takes less than a minute, really, if you're just hit all those buttons, and there are a couple different categories, or I think three or four categories.
3 domains.
Yeah, and I think 10 questions each category, maybe.
16 total. Yeah, I can't really reveal them because we're not done yet. But yeah,
it's brief. It's brief.
Yes.
It's easy, and for somebody like myself who also has some clerical duties that are attached with each and every one of my interpretations throughout the day, it was an easy thing to do, to be able to measure whatever it is that you were looking for from me, to be able to gather that data. So I just wanted to sort of briefly talk about the tool as a practitioner. That's all.
Yeah, thank you. Yeah, and so I don't have the information from a manager standpoint, so it's lovely to hear from Mélida and Nathan. I won't talk too long. I just want to mention one other piece. From a quality standpoint, we certainly have all kinds of opportunities to be observed by our leadership, just to give us input, help us grow. And then anecdotally, we have all kinds of information in terms of how we're perceived, maybe by the staff we work, in terms of the success of the encounter. Did the patient adhere with the plan of care? Was teachback successful when they asked them several questions after they just did a 2-hour teaching on cardiac defect risks? And so that's most of what our quality is looking at, in the sense that it's mostly anecdotal or direct observation by our leadership. But Nathan, how about you?
I would have to admit I'm less familiar with quality measures and more familiar with the productivity data of just the quantity and volumes data is kind of my primary view. We have employee engagement scores that we look at annually to sort of get that feedback from the staff, like how are you doing? And it was actually interesting. This prompted me to look at like our employee engagement score for I have the ability to sustain my energy throughout the day as one of those questions in that annual survey, and we were like 7 points higher than the organization, and like 92 out of 100. So I was happy to see that. So I would say, and then we also do like annual. That's kind of from the employee's perspective, and then we periodically do satisfaction surveys for the providers, which only tells the provider side of the story when obviously there is a patient and an interpreter involved. But it is another measure that we've gathered in the past just to get that feedback from the providers. And they'll tell us if they're like, I can't find an interpreter when I need them, or they're in a rush out the door, like we might get that kind of feedback from the providers, in addition to our staff who feel stressed. But I just wanted to say, I feel like quality and productivity are like two rising pillars of water that, like, you know, we're constantly, the balance is in trying to constantly improve both. You know, and it's interesting as I thought about this, to me, that like one of our value adds and kind of selling points in our internal staff program is that we have certified interpreters that are, you know, we know they're great interpreters because we work with them every day, and they know our healthcare system, and they have a high quality. And in order to have them in our system, we have staff people that are at busy enough sites that we can keep them productive. So like that quality, like, it's sort of an interesting twist on the question that, like, we know we're providing this quality, but only as much as we can actually find them something to do. So anyway, I just think that we're always working on quality, and then at some point, you know, you get that pushback, like the system starts to bust. You know, the interpreters are pulled in different directions, and the schedulers can't get them to their appointments. And so I think in closely working in conversations with the schedulers and the interpreters and the managers, you work that stuff out. It's not, you look at the data to really find like weak points maybe, and like it suggests places to look, like, could we staff this language better? They're sort of at the bottom, but it in no way is like this data point says this is not right. You know, it's just like suggesting, okay, this data is telling a story, and now we have to go talk to managers and schedulers and interpreters and see, like, is there anything we can improve here? You know, so I see it as like a dialogue and a conversation led by data points more than in order to achieve quality and productivity, more than just like the data rules and you have to follow this, because that's not cool.
That's a great way to look at it.
Let's talk some more, Nathan. Okay,
absolutely.
So I have another really terrific question. What is your secret? Are interpreters aware of expectations regarding those? And that's a question that's very open to interpretation. No pun intended. So let's start with Andrea.
Well, I wouldn't think, again, as a staff interpreter, I would say that my management is constantly sharing with us the leadership, and like I mentioned in our staff meetings, and we get email communication about what our current quality goals are, or our next performance measure. So we're aware, and we're also involved in those conversations. Lately, we've been talking about a few different ideas about how to improve some of our dispatching issues. And so the dialogue is constant. So I would say that we are aware as interpreters of what our leadership is trying to do to address areas that need improvement. But I don't know what our secret is necessarily.
I like what Andrea said earlier too, something about the productivity measure was constantly changing and evolving. And I mean, for us too, the system's changing, and the modalities we can serve through phone and video now we couldn't before, and therefore the definition of productivity changes. And, you know, we're learning as we go as much as, you know, so it's like, well, we can't exactly tell the interpreters like, well, this is the cutoff points. Like, we're developing these measures, and again, it's like an exploration.
Well, I loved what you said about, I think your secret is that you use the data point as a sort of a rough guide to, you know, sort of lead the conversation, as opposed to having it be the hard stop rule, right? That it's
I think that is kind of a mystery behind it. I think interpreters get nervous, like, oh my God, if I don't drop a charge on this encounter, then it's not going to be counted, and they're going to come after me that I wasn't busy that day, and oh my gosh. And I think that the mystery and the secret kind of scares people into an irrational fear that they don't need to have, because that's not the way that we look at it, you know?
Yeah, it's tough. But yeah, what do you think, Mélida?
Well, you know, I understand we have a tremendous responsibility as interpreters, right? So right then and there, we're all a little apprehensive about, you know, whether or not we're going to be able to convey the message accurately, right? So again, to basics. earlier on, I was talking about level setting expectations. We have to understand what the organization expects from us, and I have to, have those clear expectations. But it's not just in terms of how I'm being measured. Remember that we're working with different technologies, different platforms. Anita, you do OPI and VRI. I monitor OPI and VRI. It's no longer just focusing on interpreting, right? There's the multitasking involved. So we need to be aware of our role as interpreter, the standards, the guidelines, the technology, all the platforms that we're being monitored, what are we being measured on, and that is something that it is part of quality. We want the interpreter to know that they have the responsibility, but that they also are expected, to measure exactly where we want them to be at a very high standard. Like I said before, sometimes the traffic can be very heavy, right? When it comes to the number of calls, it's back to back. This may be a good segue into interpreter fatigue, but it's all worth it. Why? Because of the LEP community. That's what we're here for. That's why I was saying this is a noble profession. But we have to understand what those expectations are. We have to also understand that we're here to also establish that rapport and ongoing relationship with the client. Whether it's an internal or an external client, you have to understand that there's that relationship there that needs to be sustained, that needs to be sustainable. And if we're not aware of what's going on, if we don't get those comments from clients, whether it's in the form of a complaint or a commendation, we're not going to be able to understand what's out there, what those additional expectations are. So going to what Nathan does best, you measure data, you analyze it, right? And then you're going to be controlling or monitoring the data. We do the same in quality, and then we reach out to our counterparts within LanguageLine and see, if we can come to an agreement in terms of making sure that life is easier for the interpreter. All things, because currently it's not easy. And add the pandemic to that, right? So we could go on and on here forever. But
Yeah,
I'll stop.
So I actually wanted to speak to this very briefly. For me, my expectation here at our organization is that the bar is very high. We set that, not to say that anybody else isn't, setting the bar high, because I know countless interpreters and leaders throughout the organizations in the United States and beyond. However, one of the things that I think is so unique about my experience here for the last 17 years is a level of autonomy that's given to me to be able to, as you said, the art of interpretation. So to be able to produce, to be able to produce at a very quality level, to be able to be responsible. I mean, it's an enormous responsibility to shoulder and to build rapport, not only with I look at it like I have two clients, actually three. So I have the provider and the patient. I have the organization to whom I answer to. But then I also have me, who has to sleep at night. So that's actually four. So sleeping at night, knowing that I did the very, very best. And one of the secrets that I have is to make sure that I'm worried most about what's happening on one end of my desk to the other, leaving the experts to do what the experts do, and really just focusing on what I can do for myself, and just knowing that inside of that autonomy, and I know that we're being monitored, I know that we're being measured, I know all those things are happening, but I also know that at the end of the day, when I clock out at night, I can know full well that I've done the very best I can from the time that I got in there to the time that I left, regardless of whether or not I'm tired. And it's been all hands on deck for all of us since far before March 2020, but definitely since March 2020. So I just wanted to put that out there that, while we all are doing our best to sort of oversee and data analyze and everything else, there's also credit needs to be given to the interpreters where credit is due for those who are really just, fighting the good fight and being here for the patient population and the patient experience of care in a way that's just admirable, I think.
And I would agree wholeheartedly, Anita, especially when you consider that satisfaction and job engagement play a huge part in quality. And the autonomy plays a huge part in quality because it does provide more satisfaction. Having that kind of trust goes a long way. And we are at the 5-minute mark, according to my alarm.
Wow.
Does that mean we have a few more minutes, Natalia, now that it's the 5-minute mark, or does that mean we should
Absolutely,
wrap
yes,
up?
you have
Oh, we
5
do?
minutes.
Okay.
So I've got
I
3
wanted
more.
to say one thing. Can I say one thing about fatigue, Anita? As you were talking, you made me think, and so did Mélida. So much of what we do is analyzed, and I personally do really appreciate the analysis. I really do. But when I was in management, the numbers never matched the reality, and it was really frustrating. And I just remember thinking, and like you said, Nathan, interpreters get nervous. If we're not busy enough, when are they going to start getting rid of the jobs? And there's a hospital in Atlanta that did get rid of a bunch of interpreters not too long ago. So this is the reality that we're in. They went entirely to remote, which is a fine option. It's just in many ways it made me realize they didn't understand the value of those interpreters that they had. They may not have been able to really analyze the data in a way that was more fleshed out and comprehensive. And so when I was in management, I just thought these numbers do not look like what's really happening. And that really was what motivated me to start developing the tool, but it took me years for that seed to grow into something. And it took the NCIHC listserv and Natalie Kelly posting a question asking, how are you guys analyzing workload? And every single person had the same response, which was just divide the minutes worked by the minutes paid. And that will never yield anything that impresses very many administrators, despite having a very phenomenally qualified team, like you mentioned, Nathan, people that have been at the organization for so long that they understand the culture, like Anita, they understand the culture, they understand the sociolinguistic patterns of not only the staff and providers, but the patients that are seen there. That's an incredible thing. And then to have them look like they're not busy enough, even though they are functioning at a level like a nurse in the ICU, but they're not really being given the credit for it because it's just not analyzed in a way that actually incorporates what an interpreter is doing when they're processing that kind of information and trying to interpret it or channel it despite demands on concentration. So my hope is with this tool, we'll be able to add that so that we can keep people happy, we can keep people in the field. And like Anita said, she's been at her organization for 17 years. That's phenomenal. That actually speaks volumes about the management there and what they're able to do to keep people happy, which I think is an enormous part of qualities, keeping people for longer.
Well, my senior leadership really considers us the virtual frontliners, and will say so and say as much to anyone who will listen, because they know that that they understand about the vicarious and secondary trauma. They understand. They give us opportunities constantly to be able to not only better ourselves within our career, but also to decompress. Ways in which we can do that, mindfulness trainings, whatever it is that is available, we're availed of that if we so choose to take that on. So that's something really, really important for anybody who's listening, who has a crew of good interpreters that they want to just really nurture. So I have 3 more questions, but I'm going to choose one, and I want the person who feels the most compelled to answer this. What is the key takeaway when considering measuring the big 3, aka productivity, quality, and fatigue? Ready, set, come on.
I have one, but I was the last speaker, so I want someone else to go.
Right? I could ask a different question, but.
Oh no, I like that question. I've got an answer for it.
Let's talk about fatigue though, right? And I don't know, do we have like a minute? Minute and a half, Andrea, how are we doing?
I think maybe a minute. It's 2 o'clock.
Interpreters are the heart and soul of any organization, all right? Just to back you up on what you just said, Anita.
Thank you.
When it comes to interpreter fatigue, I think that we all need to remember that, the put your mask on before, assisting others routine, like, on the airplane. It is important for the interpreter to be well rested. Again, everybody knows this, right? Be well rested, well hydrated, have a good night's sleep. What to avoid caffeine, breathing exercises, meditation, anything that's going to help you. If you are OPI or VRI, make sure that your workstation, it favors your style. Hey, if you're able to get up every time, go ahead, go to the kitchen, come back, and that sort of thing. Stand up for 10 minutes. You want to make sure that you always keep in mind what the end result is. What is it that you want to accomplish as an interpreter? LEP community, the LEP community is relying on us. But you also have to be aware that there are many people within your organization and beyond that are backing you up and that are making sure that you get all the tools that you need and all the support that you need. Yes, productivity needs to be measured, because that's our reality.
And for those who don't know what an LEP community stands for, because there may be some people who aren't up on the lingo, if you could just.
Good point. Limited English proficient person. Okay. Our heart and soul as well for the interpreters.
Or the culturally diverse community.
Yes. What I'm saying is
diverse.
we need to be very much aware of what everything entails in terms of what is it that we need to do during the interpreting session, but always know that there are people there to support you. Even if we're measuring data, analyzing and controlling and monitoring that data, we are gathering the data to ensure there's continuous improvement. If there's no continuous improvement, then we don't have those new platforms, that can also help the interpreters. So just wanted to say that.
Yeah, you're right. You got to measure. So mine is one sentence, and then I'm going to let Nathan go, and he can finish with a lot more. I just think that those three, mental fatigue, productivity, and quality, they're related in that I think we have to incorporate mental fatigue as an actual number into the productivity percentage so that we actually yield good quality. Because when interpreters are mentally fatigued, they're not yielding good quality. And if they're mentally fatigued and it's not being addressed, they're not very engaged and they might be more likely to get burnt out. And our tool is not a chronic measurement at all. It's looking at the actual mental fatigue in the encounter itself. But ultimately, I think we could prevent burnout. I think we could prevent some degree of loss of interpreters that are qualified because they get tired of not being heard, or maybe they just get tired of the workload and the productivity percentage, maybe not giving them what they really need, or having those breaks, or getting what they actually need in order to yield good quality. Just like the same thing with any other service line in a hospital. You have a lot of people leaving when they're burnt out because something about their workload's not being addressed. And I think we could do better. I don't think it's perfect, and I think there's a million other things we could probably do, but I think if we could measure mental fatigue with an actual number, we could have a better understanding of what the productivity really is and have better quality.
Thank you so much.
Nathan,
really.
it's your you're on. It's all you.
I just want to summarize it that like strong productivity scores, the highest people have like the biggest commitment and are just like, I'm here to serve patients and I want to serve lots of patients. And you can see that passion in their scores, And I think our job as leaders is really to give them the work to serve the patients, We're not staffed, if we're overstaffed, and these people with all these passions also have the opportunity to get bored and burn out in the opposite direction, and discompassion fatigue, right? And so I do think there's a balance and we can achieve that. And I think everyone's here to work really hard and share our love and our passions and our work. It's pretty clear by this group.
And it takes an extraordinary individual to do interpretation in any field. And I just want to sort of shout out to my colleagues across lines, state lines, country lines, and thank them all for the incredible work that they do every day.
Yeah,
and
thanks
to
in the field.
CCHI for this opportunity for us to have this great conversation.
Well,
Yeah, thank you.
thank you. Thank you. Amazing conversation, amazing group. I hope we would have had like 1, 2, 3 more hours to talk about this,
I
right?
know.
Because this is such an interesting topic. We have lots of comments from the audience saying how valuable and true this conversation was. And at the same time, there were a couple of comments saying that, oh, like we are not aware of those standards. So that's why we brought this conversation to everyone today, so that you as an interpreter understand that your leadership should communicate with you their expectations of you first and foremost. And that doesn't matter whether you're working at a small hospital, for a small agency, or a large international agency, or a large cross-state health system. So thank you, everyone. Great conversation. I wish everyone
Okay.
having a good rest of the week and good weekend.
Thank
Thank
All
you.
right.
you.
Thank you
Thank
all very
you.
much. Great to see you all.
Take care.
Bye-bye.